Hi everyone, how are you? Today's our topic is chronic cough. As you know, it if persistent, it can affect our personality. A chronic cough is a cough that lasts 8 weeks or longer in adults. A chronic cough can interrupt your sleep and leave you feeling exhausted. Severe cases of chronic cough can cause vomiting, lightheadedness, and even more. While it can sometimes be difficult to point out problems that are fortunately, chronic cough typically disappears once the underlying problem is treated. What are the symptoms of the chronic cough? A chronic cough can occur with other signs and symptoms which may include runny nose. Number two, a feeling of liquid down the back of your throat, posterior nasal. Number three, frequent throat clearing and sore throat. Number three, hotness, loudness of your voice. Number three, wheezing and shortness of breath. Number six, five, six, heartburn or sore taste in your mouth. Number seven, rare cases coughing up blood. What are the causes of the chronic cough? We will look on it. Occasional cough is normal. It helps clear irritant and secretion from the body. However, a cough that persists for a week usually result of medical problem. The following causes alone is a combination are responsible for the majority of cases of chronic cough. Number one, post-nasal drip. Number two, when your nose and sinus produce extra mucus, it can drip down the back. This condition is also called upper air cough syndrome USA. Number two, asthma. It can lead to asthma. An asthma related cough may come with the season appear after the in the type asthma cough variant asthma cough is the main symptom. Gastroesophageal reflex GERD disease. In this common condition, stomach is the flow back into the tube connects to your stomach. The constant irritation can lead to chronic coughing. The cough in turn worsens GERD, a viscous cycle infections. A cough can linger long after symptoms of pneumonia, flu, or a cold. Common cold under recognized cause a chronic cough in adult producers. Chronic cough can also occur with fungal infection of the long tuber. Chronic obstructive pulmonary disease, COPD. COPD are chronic inflammatory lung disease that cause excessive airflow from the lungs and include chronic bronchitis can cause a cough that brings the upload colored sputum. Suffocation causes shortness of the breath and damages the air. Most common with COPD are current or former smokers. Blood pressures drugs can lead to chronic cough. ACE inhibitors, which is called commonly prescribed for high blood pressure and heart failure. Less commonly, chronic cough may be caused by aspiration for food in adults, foreign bodies in the children. Bronchitis damages dilated airways. Bronchiolitis inflammation of the very small airways of the lung. Cystic fibrosis. The causes of chronic. Laryngopharyngeal reflex stomach is flow back into the throat. Lung cancer. Non-asthmatic bronchitis airway inflammation not caused by the asthma. Sarcoidosis collection of inflammation cells in different parts of your body. Idiopathic pulmonary fibrosis. What are the risk factors of the chronic cough? Being current former smoker is one of the leading risk factors of chronic cough. Frequent exposure to secondary smoke can lead to cough and lung damage. What are the complications of chronic cough? Having persistent cough can be exhausting, no doubt about it.